Welcome to the Existential Therapy lecture. Let's get started. So this approach was primarily developed by Viktor Frankl, and there are several other individuals such as May, Yalom. So there's a number of individuals who also developed and kind of furthered and continued this approach. Yalom is very well known within the field. He's written tons of books. And these individuals were all influenced, again, going back to Freud, going back to Adler, and you're going to continue to see this kind of, if you drop a stone in a lake, there's this ripple effect. And so you're going to continue to see that over the course of other therapy approaches that we'll look at this semester. Frankl and Yalom and May were also influenced by philosophers. So think Nietzsche. And so this approach is a little bit different because it's more philosophical in nature because of those influences. Arguably for Frankl, if you're not aware, if you didn't read the textbook chapter this week, one of his largest influences was being a prisoner in a Nazi concentration camp where he, of course, experienced horrible atrocities. His whole family was killed. And so imagine, this individual who goes through this, his parents are killed, his brother is killed, his wife and children are all don't survive, and he's basically the lone survivor of his family, and he goes through that experience, and because of that he develops logotherapy, which is basically therapy through meaning, or looking at what is the meaning of things. How do we ascribe meaning to things? So one of the philosophers going back believed that every moment, by our action, every moment we are choosing who we are, essentially. Our existence is never fixed, it's never finished. We're constantly in this stage of transition. We're constantly evolving and changing and growing. And I really love that approach because it's very true, right? If we're stagnant, a lot of people experience that and feel that. And it's one of the main reasons that individuals will come to therapy where they feel stuck or they feel like they can't overcome whatever their issue is, or they're trying to reach for their goals, but they, for whatever reason, just can't achieve it. And so by helping people become unstuck, or by helping them continue to grow and expand and change and evolve, that's a big part of this approach specifically, but kind of generalizing to all therapies. As your textbook says, existential therapy is a way of thinking. It's an attitude about psychotherapy. It focuses on understanding human nature, understanding what it means to be a human being. That's the underlying factor of this approach. We've already talked about how it's very philosophical in nature, which kind of makes it like this hard, it's kind of intangible. Like, what exactly is existential therapy? Well, it's understanding human beings. It's also exploring certain themes that occur for us as humans, such as mortality. Death is a huge factor of being human. Meaning, as I mentioned earlier, what meaning we ascribe to things, what are the things that give our lives meaning, freedom, responsibility, anxiety, aloneness as related to whatever the client's current struggle is. We are what we choose to be, essentially, rather than victims of chance. So again, this is getting away from Freud's thoughts of, deterministic approach of that life just happens to us and there's nothing we can do about it. This is very much, we have a choice, we are making that choice, and by making that choice, we are then becoming whatever that choice is, essentially. So for example, if you're someone who decides to go to the gym, and you go to the gym and you go to the gym and you go to the gym, essentially at some point you become a person who's like, yeah, I'm an athletic person, or I'm someone who is active, I'm someone who goes to the gym constantly. And that becomes part of your identity, or an aspect of your identity. And so in terms of your practice with your therapy clients, this can show up by helping them refocus on what is within their control, right? What is that decision that they can make, or what is the choice that they can make to change whatever their situation is, or whatever that factor is that they're feeling stuck about. And you can imagine that this comes up a lot in therapy because we as humans tend to focus a lot. You might notice this as you start to listen for it in terms of how your friends talk or how your family members talk. We tend to focus very much on what is outside of our control. Well, if only he would fix this, if only she would fix this, if only my husband would take out the trash, if only, etc., etc. And we tend to lose sight, or we tend to not focus on what is within our control, right? I can't control what my husband does. I can't control what your brother, your sister, whoever does. An example that I use in several different versions is, my mom. I love my mom to death. She'll call me and she'll say, like, brush your teeth. You need to make sure that you're flossing. Are you flossing? Make sure that you're taking care of your teeth. My mom can't control me though, right? She can only look at her own lived experience and then try and, say like, okay, how can I help my daughter? But me brushing my own teeth or flossing my own teeth is outside of her control. And so hopefully that's an example that you guys can think about, like, oh, okay, what are my family members or friends trying to, what do they say or do that's them basically not trying to control you, but it's a factor that's outside of their control in terms of whatever decision you're going to make. Another example, and I think we've talked about this in a previous lecture, is like individuals who are at that point where they're trying to decide, what should I do as a career? Family members will say, go be a doctor. I think that you should go be a doctor. I think that you should go be a lawyer, go be, etc. That's, the family member maybe not necessarily trying to control that person, but definitely trying to strongly sway their decision making. So again, just highlighting that we tend to a lot of times focus on what's outside of our control, and that then causes sometimes stress and frustration when individuals don't act in a way that that we want to control them, or in a way that is what we want for them, or etc. As your textbook says, once individuals recognize their role in terms of creating their life, in terms of making decisions, it really starts to change their situation, and it really starts to change the way that they view the world, that they view life. Because, once you start to realize, like, oh, I do have control in this situation, or, oh, I can, like, choose my destiny, if you will, or I can choose how my life turns out, or the goals that I go for. It really starts to change not only that person's situation, but it can be hugely beneficial in therapy as people start to experience the changes that they want to see, and as they start to experience hope of, like, oh, I can change. Oh, I am achieving my goals. Let me become even more committed to my goals, or let me, put even more work towards whatever I'm trying to achieve, which can be a really cool experience to not only witness but to be a part of as you're helping someone else move towards whatever direction or whatever goal they're trying to achieve. Something that I do want to highlight in this sense is that this approach also tends to be action oriented, in the sense of it's not just philosophically, let's talk about it, but because it's tied to that aspect of, like, let's make a choice, or the choices that you make are essentially you becoming whoever you're going to become. It's also about action as you move towards that choice. And so it's not about venting. It's not about, oh, let me just come and talk, and when I'm done talking, then I move on. No, it's very much about, it's unlikely that change will occur if there's not some type of action tied to it. So what is the action that you're going to go take as part of this therapy session, next therapy session, etc. I really like this quote. It might be small for you guys to read on the screen, so I will read it to you. I came across this probably in my early 20s, and it's something that I think about occasionally. It's a very philosophical, like, again, kind of going back to those decisions that you make. So it says, what if someday or night a demon were to steal after you into your loneliest loneliness and say to you, this life as you now live it and have lived it, you will have to live once more and innumerable times more. And there will be nothing new in it, but every pain and every joy and every thought and sigh and everything unutterably small or great in your life will have to return to you, all in the same succession and sequence, even this spider and this moonlight between the trees and even this moment, and I myself. The eternal hourglass of existence is turned upside down again and again, and you with it, speck of dust. And so essentially, I won't read the second paragraph, but essentially, the question is, if you had to live every single moment of your life over and over for, infinity, would you continue to make the choices that you're making now? Would you continue to live your life and relive it? Or would you start to do something differently? Would you say, yes, give me this life that I currently live? Or would you say, like, oh God, no, please don't make me continue to live this life? And so I think if we were in class, this would be a fascinating and really fun discussion of, if you found out today, for example, that you had only 1 week to live, what would you do differently? Would you do anything differently? Would you continue to live the life that you're currently living and continue to make the choices that you're making? Or would you do something differently? And I think it's such a fun philosophical idea and concept to play around with of, would I make changes, or am I happy with my current life? And it's something that might be worth you guys spending a few minutes thinking about. Would you change anything? Would you continue to live your life? Even every small little nuance are the things that bring your life meaning, coming back to meaning. Are those things that bring your life meaning or value, are they worth whatever that pain and suffering is? Which is something that we'll get into a little bit more in the next couple slides. So again, just philosophical questions that this approach tends to ask and tends to consider. Why am I here? What gives my life purpose? What gives my life meaning? What are the sources of those meaning? What does all of that look like for me individually? And so that's one of the cool aspects of this approach, is it really makes it so that you're able to focus it in on whoever the client is, whatever brings meaning to their life, or whatever decisions and choices they're making, really able to make it individualized in terms of treatment plan and approach, as opposed to just kind of a cookie cutter template approach. So there's a lot to cover in this slide, because the view of human nature is really hugely what makes this approach this approach. At its essence, I think many of the factors are at the core of what we're going to see in pretty much every therapy approach, right? Like self-awareness, etc. We'll talk about self-awareness and other approaches as well. And so once you take out the techniques, there's kind of this essence of, okay, you're going to see this again in every therapy approach. For many therapists, sometimes it's hard to change anything until we know exactly what needs to be changed or exactly what we're looking at. And so what this really ties to is that self-awareness piece, right? Without increasing someone's self-awareness, kind of going back to what we saw. So this is very similar to the idea of Freud in terms of bringing the unconscious into the conscious. Like, how do you change something if you don't even know that it's happening? And so increasing that self-awareness as applied to whatever it needs to be applied to. So for example, increasing awareness of options, increasing awareness, going back to a previous slide, of this is within my control and this is outside of my control. Increasing awareness of where are we stuck, how do we get unstuck, increasing awareness of what are our personal goals, our career goals, how do we achieve those goals, increasing awareness of what are the factors that are influencing us, whether that be biological factors or environmental factors or situational factors, such as maybe something's happening in your environment, or situationally, maybe you just broke up with someone or someone just broke up with you. What are those situational factors? So increasing awareness around all of those things, very similar to what we've seen in previous approaches, and consistently we'll see that moving forward. And so again, that's a huge part of therapy, and basically making any change in terms of therapy, or making any movement in therapy, is, again, not to be redundant, but how do you make any change if you don't even know that you need to change, or if you don't even know what the options are, or where you need to go, or what needs to happen, or how you're feeling, or etc. I think you guys get the point there. Self-awareness, hugely important to therapy. In terms of moving forward, so I had an analogy here. I'll skip it because I think you guys get the point in terms of self-awareness. Freedom and responsibility. So One of the philosophers believed that we're constantly confronted with this choice of what kind of person do we want to become. I think we kind of have already talked about that. And that ties to also living authentically in terms of the choices that we make, being responsible for the choices that we make. So it's moving away from, again, this deterministic approach. It's moving towards, I'm not the victim here. I'm the person making the choice. And because I'm the person making the choice, let me, one, I have freedom to make that choice, but two, I'm going to take responsibility for that choice as well. Identity and relationships. So this gets into how is identity created? What are the factors that create identity? I think we kind of talked about that already in terms of if you make a choice over and over and over, at some point that becomes an aspect or a part of who you are, such as, I'm someone who's athletic, or I'm someone who likes to ride horses, or I'm someone who, plug in whatever those things are about you that you like, or the things that because of your decisions make up a part of who you are. I'm someone who likes, I don't know, vinegar potato chips, or I'm someone who likes chocolate, Dove chocolate, or, whatever those factors are that make up your identity, and the creation of your identity. So if you're someone who, a lot of times our clients come to us and there's an aspect of themselves that they don't like or that they don't want to be present, part of that is also then looking at, okay, this is also part of your identity, and what is it that you want to change, and how do we move towards making that change? So for example, if someone comes in and say they're overweight and they want to work on losing weight, or they want to change their view of themselves, that's also a part of identity, and that's also a part of therapy and moving towards change in terms of those choices. Relationships, again, I think you're going to consistently see this theme. We saw this very strongly in Adlerian therapy in terms of the social identity and social orientation. And so you're going to continue to see that in terms of establishing meaningful relationships and how that's hugely important to this approach as well. In terms of search for meaning, purpose, values, goals, there's also this idea of if we're unable to tolerate ourselves when we're alone, how can we expect someone else to? If we're, kind of going back to this idea of if a client doesn't like themselves, if they don't like themselves, does someone else like them? And a lot of times our clients believe, well, like if I don't like myself, then no one else is going to like me. And oftentimes that's not true. And so it's kind of a dual-sided coin in the sense of there's aloneness in the sense of how do we as humans, we come into the world alone, if you will, we leave the world alone. And so how do we grapple with that sense of aloneness? But that aside there's also this sense of loneliness or aloneness, and how do we make sure that we build relationships and build connectedness so that we are not alone, so that we have that connection. And the thought there being that that's a really healthy aspect of dealing with unhealthy thoughts, dealing with unhealthy emotions, dealing with whatever the factors are that aren't helping us in terms of whatever our goals are, or whatever wherever we're trying to get to, etc. Identity. So we've already talked about identity, how that's created, what that looks like. Values. So remember that we talked about values probably I think it was the very first week I had you guys write a discussion post. And so in terms of our search for meaning, this also ties into values in terms of what's important to us, how those factors, whatever those values are, drive our decisions, drive our choices. And so you kind of see how a lot of these things are all interconnected in terms of values, in terms of choices, in terms of self-awareness, in terms of freedom, etc. Anxiety. So, existential anxiety is being confronted with factors such as death, freedom, choice, isolation, meaninglessness. Essentially, the fact that as a part of being human, we are mortal, we are at some point going to die, we do experience pain and suffering, and that essentially that is a part of being human, right? Like if you were dead, you wouldn't experience pain, you wouldn't experience fear, you wouldn't experience anxiety, but you also would not be alive. And so essentially it's almost kind of like a ticket, or it's a, it's essentially a part of being alive. It's you, there's no way around it, right? And so knowing that going into it, how do we say, okay, I know that this is a part of it. So how do I grapple with these things in a way that's healthy and in a way that I'm not becoming stuck, or I'm not, letting, for example, a fear of death drive my life or ruin my life. And we saw this to some extent going back to Roger's case, Vignet, in terms of, he experienced agoraphobia and it was essentially ruining and running his life. He was so afraid that he couldn't go places by himself. He always had to have a friend with him. He, wouldn't take jobs because of fear. And so it was basically running his life. And so part of this is, how do we grapple with these things without letting them like overcome us, or, completely dictate our choices and how we live? Death. This approach also considers the fact that we're all going to die. And so again, how do we confront that? Especially, I think this is one of those themes that was hugely applicable and was a factor that I think really occurred during COVID, in terms of how do we confront this? How do we deal with the fact that at some point we all pass away? And so how do we, again, just how do we handle that without ignoring it? Because ignoring it doesn't make it go away. Without running from it, because running from it also doesn't make it go away. Therapy goals. So instead of going over to these, I would say more so, consider and think about, how are these therapy goals different or similar from what we've seen in past therapy approaches, Adlerian therapy, Freud's psychoanalysis. Are they the same? Are they different? What do you guys think? Is there overlap? That's what I'll say about that. Since we talked about anxiety in a previous slide, I wanted to discuss it a little bit more here. So think about situations where you've been engaged in a hobby or an activity or something that you enjoy, something that was maybe active, say running or snowboarding, or even just going out for a walk where you maybe got your heart rate up. What were you experiencing? What kinds of symptoms were you experiencing? Such as maybe like if you're out snowboarding, you might be getting kind of sweaty because you're being physically active. If you're going for a run, you're also sweating, but your heart rate is increased, etc. And so now change that to thinking about times when you were stressed in maybe more of a negative way. So for example, experiencing stress because you had an upcoming test, or because you had something due, or because you had a boss at work that was stressing you out. And notice, were you experiencing similar or the same symptoms as that hobby or that thing that you had enjoyed versus something that you didn't enjoy? And a lot of times the symptoms are the same. So if I'm running, I'm experiencing sweat and increased heart rate. And if I'm I don't know, dealing with a boss at work that's stressing me out, I'm experiencing increased heart rate and sweaty palms, or increased sweat. It's the same symptoms, but how I perceive them or how I view them is very different, right? One I'm enjoying and having fun, and one is not fun and I'm perceiving it to be stressful. And so essentially, how we perceive or how we view the stress or the stress factor is a part of how we then interpret it. And that's also a huge aspect of this therapy approach. Frankl would say it's all about what you think about it. It's all about your attitude towards it, as opposed to whatever that thing actually is, whether it's snowboarding or, say, a boss at work. It's much more about your view of it, which I think is super interesting. So I just wanted to throw in some Frankl quotes, just because this, he's one of the huge individuals that influenced this approach. And so read these examples on the slide, think about it, and maybe this will be one of the discussion questions that we have for this week. Group therapy, we've talked about group therapy in a previous approach. I just want to touch on something here. Group therapy you'll see pretty much in every approach that we cover this semester. The American Group Psychotherapy Association does have guidelines and does have a lot of great resources and information if you want to learn more about group therapy, if that's something that interests you. I do want to say that a lot of times I think there's assumption that just because you're an individual therapist, you can then very easily transition into group therapy. And I don't think that that's correct. So the AGPA, they have a certification, so additional training if you want to go become a group therapist specifically. I thought about including a video, but all of the videos I found on YouTube were like very, very dated. And so I decided not to do that. But think of group therapy as watching popcorn pop. You know, like it's popping over here, it's popping over there. That sounded funny. There's a lot happening in group therapy. Like this person over here will say something, and maybe it's directed towards someone over here, and that person might like kind of get catty back, and then this person over here might say something. So there's a lot happening in group therapy. And so if you're not very attuned to not only the individuals in the room, but also what's being said, what's not being said, facial expressions, verbal, what's being said, but also like intonation. There's just a lot of factors to be paying attention to in group therapy. And so if you're not really careful, you'll miss a lot of the like content or the substance of the group therapy. And so I just want to highlight that I think one, either you need to be really solid at managing a group, or you need to go take some additional training to be able to effectively do group therapy. We've talked in a previous class about how group therapy can be really beneficial. The same thing applies here. It's just its own unique spin in terms of those existential factors or themes, which we've already talked about. So research, I wanted to include this because existential therapy is one of those approaches that's not as studied as some other approaches, like CBT is very well studied. And so I think this is interesting just looking at how this applies to a medical setting. This study was conducted in the UK in a primary care setting. And so what does that matter? Why would I as a therapist care? Well, if you're a therapist, if you're a counselor who ends up being, deciding to work in a setting that's a medical setting, a hospital, that type of location, this can be very useful and beneficial for you to know. So this study explored the outcome of applying existential therapy in working age adults who were referred for psychological interventions for whatever they were experiencing, depression symptoms, anxiety symptoms, as a part of being in a primary care setting. So essentially, if someone was seeing, let me come up with someone's like a fake client. I keep going to Anne. Anne seems like an easy name to think of. So Anne comes in to see her doctor, and her doctor notices that she's endorsing, some depression symptoms or some anxiety symptoms. The doctor might say, okay, hey, would you be interested or open to a referral to a counselor or a therapist, just to have someone to talk to or to work out whatever's going on here. If Anne says yes, then they might, either be involved in this type of study as you see here, or it can be beneficial just in terms of the outcomes or the results of this study. So the participants were men and women, working age adults as already identified, and the data that they gathered was they looked at the Patient Health Questionnaire 9, which looks at depression symptoms. They looked at the Generalized Anxiety Disorder 7, which looks at anxiety, and then they looked at a screener of psychological distress. And in terms of procedures, So in terms of procedures, what they did was they asked individuals, the participants, to complete 6 sessions, and then they looked at post-treatment. So they did a 6-month follow-up and a 12-month follow-up. And in terms of inclusion-exclusion criteria, inclusion criteria you had to be experiencing some types of symptoms of anxiety or depression, because that's what they're looking for this study. In terms of exclusion criteria, they excluded individuals who were like at extreme or very high risk, just because individuals who are experiencing those types of very, very severe symptoms, so for example, like suicidality, that could have ended up throwing off the results. One of the limitations of this study is that they only had 41 individuals who actually completed the entire protocol. And if you think about it, 6 sessions can be a lot for some people. Like maybe either they don't have the time available to do a full 6 sessions, or maybe it's really hard to get off work to be able to get to the doctor's office. Or sometimes people get better. Like, hey, I initially wanted 6 sessions, but I'm actually doing better at 4 sessions, so I don't know that I need to complete the next 2. And so that's one of the limitations. They didn't have very many people, likely due to a variety of reasons why individuals dropped out. In terms of future research, these researchers, Rayner and Vitale, they said that if they were to run the study again, they would want to use better scales and scales that looked at more factors. So for example, things like self-esteem, relationships and connections, motivation, that type of information, just to look at were any of those external factors also impacting results in terms of treatment, and specifically, of course, existential therapy improvement. The results, so the 41 individuals who did complete this study experienced a reduction in depression and anxiety symptoms. They experienced a reduction in terms of psychological distress, which is really awesome. And they also experienced a reduced need for psychological services, which is also pretty cool to see that existential therapy can be beneficial in terms of those different areas. That's what we would want to be looking for if we were to decide to use this therapy, one, either in this type of setting or in any other setting that you decide to work in. So for example, if you decide, hey, I want to work in private practice, you would want to know for sure, like, hey, this is an approach that's actually going to be beneficial to my clients. In terms of implications, the results show that existential therapy is effective for reducing depression, anxiety, and it can be used in this type of setting, while also promoting low relapse and low dropout rates. So essentially, I think we talked about this either a little bit earlier in this lecture or in a previous lecture. You don't want to do things. Oh, we talked about it in the Roger case vignette. You don't want to do things that are like actively gonna make your clients not come back to you, right? Because one, that's not helpful to them. And 2, it actually might be causing harm, depending on how they perceive whatever, was potentially said or done. And so you want therapy dropout rates to be low. Essentially, you want your therapy clients to decide to stay in therapy until they get better. In terms of, lastly, what I'll say about this research, and I kind of alluded to this a little bit at the beginning of this slide, research articles and running research studies cost a lot, not only in terms of the financial burden, but also the amount of time that it takes to run a study. And so when research studies like this are conducted, it's really awesome to see that there was some type of benefit to individuals and clients, just because it can take a lot to actually look at and run a study of this size. And these are my references. Let me know if you guys have any questions, comments, or concerns.